Self-Injection Guide: How to Mix and Administer Cetrotide by the Centre of Reproductive and Genetic Health. Cetrotide may be prescribed to you during a stimulation cycle and a frozen embryo transfer cycle. If you are doing a frozen embryo transfer cycle, you will need to take this medication from day 1 of your period until day 7. If you have been prescribed Cetrotide to take during stimulation, you will usually start on day 7 or day 8 of the stimulation cycle. This is dependent on response to treatment and the size of the follicle. The nursing team will let you know when to start this medication based on your first tracking scan on day 6. Cetrotide is an injection that we advise you to administer at around 7 a.m. in the morning. It is important to be consistent with the timing, especially during the stimulation phase. Cetrotide is stored in the refrigerator. This medicine must be allowed to reach room temperature prior to injection. It should be removed from the refrigerator approximately 30 minutes before use. The solution should be used immediately after reconstitution. Please do not prepare this medication in advance. Step 1. Wash your hands. Before we begin preparing your medication, make sure to wash your hands. Step 2. Prepare your medication. Everything you need to reconstitute this medication is in the box. Remove the contents from its box and lay out everything you need in front of you on a clean surface. Open the packaging. Inside, you have 2 alcohol swabs for cleaning, a small needle for injection, a large needle for mixing, a pre-filled syringe with water, and a powder. Step 3. Mix the medication. Remove the cap from the pre-filled syringe and screw on the large needle. The most important thing to remember with Cetrotide is that the needle screws on. If you simply place the needle on, you may lose the medication. Next, snap the cap off the powder. Take the cap off the needle and push the needle through the centre of the rubber stopper of the powder. Slowly inject the water into the vial. Gently roll the medication until all the powder has disappeared. Please do not shake. When it is fully dissolved, the solution will look clear and have no particles in it. Slightly turn your bottle and pull the plunger out to draw the liquid from the vial back into the syringe. Make sure that you collect all the medication from the vial. Remove the large needle from the syringe and dispose of it in the sharps bin. Next, open the small needle and screw it onto the syringe. Hold the syringe with the needle pointing upwards to check for any air bubbles. Take off the cap and slowly push the plunger in until the air bubbles are gone. When you see a small dot at the top of the needle, the medication is ready for injection. Step 4. Inject the medication. Cetrotide is injected into the subcutaneous tissue anywhere below the belly button. To reduce skin irritation, select a different part of your belly each day. Clean the injection site with an alcohol swab. Hold the syringe in one hand. With your other hand, gently pinch your skin around the injection site. Insert the needle into the tissue at a 45° to 90° angle. Push it all the way in and then let go of your skin. Inject the medication by slowly pushing the plunger. Once done, take the needle out and dispose of it in the sharps bin. Gently apply pressure where you have just pierced your skin. That's it. For questions and further guidance, please contact the nurses on 020 7837 2905.